Hey, this is Erin from Educated Nurse, and I'm doing a lecture series on what it's like to go from an ER nurse to a breast cancer patient and back again. Lecture number 9 is on radiation and how I survived my radiation treatments, so follow along. I do want to put a disclaimer out there that this video is for instructional purposes only. The information shared is my story, and it's not everybody's story. None of the information shared should be considered expert medical advice. The information presented should not replace the information provided by your doctor. Please work with your own doctor to find the best course of treatment for you for your situation. Also, I will use medical terminology which may not be suitable for children. And please also be aware that I'm very honest. I tell it how it is. I don't sugarcoat, and for that I apologize for the occasional profanity. All right, so let's talk about radiation. For me, I was not expecting radiation to happen, to be quite honest. And not everybody needs it. It's not something that every patient will need to get if they have breast cancer. Some can just do chemo, some can just do surgery, some have a combination. So it really depends on your tumors and your treatment plan. So for me, radiation started with a planning and consultation appointment. I remember asking the doc, since I had this complete pathological response to chemo, and chemo killed everything, and then since I had a double mastectomy, did I need radiation? He said yes. He explained that we did chemo to kill the tumors, we did surgery to remove the tumors, and lastly, we would do radiation to treat my chest, remaining lymph nodes, and my underarm. The goal of radiation was to treat any remaining rogue cancer cells and the remaining lymph nodes, so if there was cancer cells remaining, we would kill them so they didn't spread. And I was like, okay, fine, whatever, I'll do treatment, I'll do radiation. After we chatted for a little while, we went across the hall and I had a CT scan to look at the organs in my chest. Before the CT images were taken, they made a cast of my upper body so that when I did go in for radiation, I would lay in the same position every time. The radiation doctor, a medical physicist, and a medical dosiometrist, a radiation dose doctor, then decided how they would radiate my chest based on the images. They were able to decide that the direction of the radiation beams, based on the images that they used for me, because they wanted to avoid radiating my heart and lungs, for me, it worked out okay. So they then tattooed 6 small black dots on my chest so they knew exactly where to send the radiation beams. The only problem I had with radiation was that my expander on my left side was a little bit too big, and so I had to go back into my plastic surgery office and they had to remove some of the fluid from my expander. I had 6 weeks of radiation, 28 days. I went in every day except weekends. And again, this is all to interrupt that cell cycle. If there is some cells or cancer that's dividing, they want to hit this radiation and interrupt that cell cycle. I would go in every day, I'd change into a gown that covered just my chest, and then I got to leave my pants on, which was kind of nice. I'd go into the radiation room, and the radiation techs would set me up just in the right position on the table according to my tattoo markings. After that, they would take an x-ray of my collarbone and upper arm to make sure that they were shielded from radiation. If they weren't shielded, they would kind of cover that. The last thing you want to do is radiate your extra bones. It can cause fractures later in life. Once I was situated and they were confident they were radiating only what they wanted to, radiation in all the different tattoos I had on my body took about 30 seconds each. So it took about 3 minutes. And in reality, it took longer to get set up and in the exact same position every day than it actually did to radiate me. I was told that common side effects of breast cancer radiation included sunburn to the treated area, skin and tissue damage and peeling, fatigue, potentially damage to my underlying lung. Not so common, pneumonia, broken ribs, nausea, vomiting, radiation to your heart and lung, blisters, and open wounds. As radiation started accumulating around treatment number 10, because you don't actually notice radiation right away, the side effects. Everything is cumulative, so it just kind of builds up in your body and then you start having side effects. But for like the first week, you're like, yeah, this is a piece of cake, no problem. And then it starts to hit you. Around treatment number 10, the fatigue really hit me. I started taking naps every afternoon. Over time, I just surrendered and took care of myself instead of trying to push ahead. While it wasn't common, I also developed nausea post-treatment, so I took nausea meds too. In week 5, so about 1 week before I was done, I started noticing a sunburn around my neck and around my collarbone. The radiation doctor said this was normal because the skin is thinner. It was previously exposed to the sun, and there's little to no fat underneath. Week 6, I had a very distinct line of redness and pain underneath my treated armpit. It pulled, it was painful. I tried my best to keep the skin hydrated, and I added some lavender to my lotion just to help it heal. In order to keep my skin moist and healthy, I did the following skincare regime every day during treatment, including my weekends off and up to 2 weeks afterwards, because again, it's cumulative, so you're still going to continue to burn for up to 2 weeks after your treatment is done. And again, this is what worked for me. You need to chat with your doctor to see if it's okay for you. But in the morning, I would shower, sometimes every 2 days, and if my skin needed moisture, I'd put Aquaphor on. After radiation, while I was in the dressing room, I put a combination of calendula cream and lanolin oil on my skin. Before going to bed, I'd rub on the prescribed mometasone cream, which is a steroid. And my oncologist would do that because it just showed in the last 5 years of research that it had some better skin outcomes. Once I developed a sunburn around week 4, I increased my Aquaphor to daily, and I added lavender essential oil to that to help my skin heal and repair. My goal was to not have my skin open during or after treatment. I survived. My thought process wasn't, it didn't come to fruition. I tried to prevent it as best as I could, but I ended up having opening skin. After treatment, my sunburn opened and I was concerned about infection, especially being back to work in the emergency room. So my doctor prescribed silver selvediazine cream, which is an antibacterial cream. I put it on 3 times a day and covered it with breathable gauze so the burn was protected and my clothes didn't get ruined. I also found an aloe cooling pad made by Lindy on Amazon. It was heaven. It was a little pricey, but it was reusable, and I kept it in the fridge so it stayed cold and it helped extend its life. On my last day of treatment, my skin started peeling, go figure, and when it peeled, it stung super bad. I was told that because you continue to burn for up to 2 weeks after radiation, it would get worse before it got better. The area on my collarbone peeled first and continued to redden. As it started healing, it was super itchy. I tried my best to stay hydrated, and 4 days after radiation was done, the skin under my armpit and under my boob by my incision also peeled. The incision hurt quite a bit, so I put gauze over it and would, just so it wouldn't rub on my shirts and sports bras and stuff. And the burn continued to worsen for 10 days after treatment, and then I noticed new skin being formed and the redness turned to a dark pink. But it took a good solid 2 to 3 weeks for everything to completely heal. And honestly, I feel like my good skincare regime is what saved me from it not being worse than what it was. And just tips for surviving: if you know you're going to be tired, get your important tasks done in the morning so you can rest in the afternoon. Again, your body is working really hard to repair damaged skin and cells, and this takes energy. So make sure to take care of yourself and let your body recover. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.